You like her, don't you? Look at those white eyes. You like her?
As we get closer to Raylan's spine surgery, she's had more doctor's appointments pertaining to her various issues in order to hear their concerns about surgery. This is one of them. This was an appointment with Pulmonary, which deals with her respiratory system. So this video probably won't appeal to a lot of people, but if you're curious about the types of things you need to think through before spine surgery, especially when it comes to breathing, this might be interesting to you. Or if you just care about Raelynn, you'll learn a lot about her in this video as well. So if that's you, it's a little hard to hear, but feel free to sit in on this doctor's appointment with us. God bless.
Hello. Hi, Dr. Pittman. How are you guys?
We're good.
Raelynn?
Yes.
You're fine.
So, I know that you guys have seen Dr. Rivera in the past.
That's right. I could not remember her name.
That's okay.
It's been so long since we
Why
have
we have a
seen her.
computer system, so like.
Yes.
And so you're here today. Is it mainly just to kind of get pre-surgical clearance, or
It's just a routine
Just a routine.
appointment we had set up, but
Gotcha,
she's
okay.
having major spine surgery
Right.
November 11th, so I definitely wanted your guys' thoughts on that.
Okay. All right. So let's see. It has been, I believe, about a year. Yeah, about a year since we saw Dr. Rivera. So I know at that time it seems like, at least from her notes, she was doing well overall from a lung standpoint.
Yeah.
Had some secretion stuff, and we kept her on the Zyrtec and Flonase as well as her Robenol.
Yeah.
Any changes in the regimen or any issues that have come up in the past year?
I don't know if it was you guys or if it was CT clearance or if it was both of you guys, but we increased Robenol a little bit.
Okay.
PRN, and that helps. We don't always give her an extra half a tablet, but
Mhm.
we do sometimes. Obviously her spine's gotten way more curved. We don't think that's hurting her lungs too much, but so she doesn't need oxygen very often at all. But the last time she needed it, she needed it for 2 weeks, and that's like the longest she's ever needed it.
Was that in the context of an illness?
We think she aspirated like on her secretions, and that a lot of times is what causes her to need oxygen for a couple days, and we just do all the protocol, shake her vest and cough assist. But she just wasn't getting over it, so then we took her to the ER. They tested and they said she had strep. I'm not sure it was the strep, but more that she aspirated and just had trouble getting over it.
Okay. And how long ago was that?
It was right after COVID started, because we had to get her COVID. So like March or April. Yeah.
And about how much oxygen was she needing?
Not that much.
Like half a liter or a liter?
Yeah. And at the end, it would just be like, I think a fourth a liter, but if you turn it off, she couldn't keep it
How
up.
low would she go?
What?
How low would she go?
I mean, she would go into like the 80s if we just left her off it. Once we realized she needs oxygen, we try to keep her above 93. And once we see 80s, we don't check to see if it wants to go lower. We just,
And was she having any other symptoms at the time? Like, was she having a cough or fever, or were you guys breathing harder?
at first, I'm pretty sure this was like 5-6 months ago now.
Yeah.
I'm pretty sure she had a fever at first. But that went away, and it just was just a little bit of rattly in her lungs, and not that much. Not that much. I don't know how to listen to lungs, but our DNA does.
Okay.
She would say, it's a little bit, but not much.
And did she get antibiotics because of the strep, or did anybody put on antibiotics because of the aspiration, or she just got better on it?
She was put on antibiotics because of the strep. And then she was put on something because we thought she had yeast in her mouth, and they gave her some else. It still to me looks white. Her mouth just always has white on it. I don't know if that's some pulmonary expertise or not.
Not exactly, but I'm happy to look.
I don't know if it's because she's very much a mouth breather, but she just always has white on her mouth.
Was she placed on like the swish and swallow that you dabbed her mouth with, or was it like a pill, like an oral or a liquid?
The second time it was which means swallow, but I mean, they're like, just do the best you can. The first time it was just a medicine we put through GP.
Right. Okay. Do you guys have particular concerns in terms of her breathing, her lungs?
I don't know how this relates to her breathing, but they're starting to notice like autonomic dysregulation with her. So I don't know how.
Like temperature or?
Yeah, like her temperature, especially since COVID started, like we can be in the sun for just a minute and her temperature will jump up to like 102.9. Right after her last surgery, she broke out in this red rash that moved around, and the anesthesia nurse said, "Oh, that happens to some people after surgery." I'd never seen it before, and ever since then, she just does that randomly. She was doing it a lot a couple of months ago, and I haven't seen it in a while.
Okay.
But the CT clinic said maybe that was an autonomic thing.
Okay.
And it's really random. It can show up really fast and look like pretty dark, and then it can be gone in 20 minutes.
It usually covers the whole body.
No, it's just patches.
Okay.
It kind of looks like what people who are nervous speaking that
Gotcha.
get red splotches. That's what it looks like.
And has Dr. Lumen talked to you guys about sort of the potential breathing complications with the spinal surgery?
We go see him Thursday to discuss surgery more. I know every time she has surgery, they tell me, like, she might still have a breathing tube when she comes out. Don't be alarmed.
Yeah. And she's not on any oxygen on a regular basis, day or night.
No, and
she doesn't need any nighttime support.
No, and she's always done so far really good with surgery. And she's had some long ones, unfortunately. I know this one, I guess, is prone, so it's more likely to.
Really, the issue is the spinal log. So the length of the surgery and the spinal log, often, because essentially they are, it's not just the anesthesia itself, it's that they are now actually sort of monkeying with her thorax, right? So where her lungs are have just got shifted around. Exactly. And, and obviously the goal is to stabilize things so that, with scoliosis, you get more and more restriction of your lungs that can impact your breathing. The goal is to stabilize that. You can't necessarily correct it or get that lung back, but you can hopefully keep it from getting worse. But it is just, it is often a complicated interface to sort of, come off of anesthesia. She sounds like she's relatively well off in the sense that, sometimes when we're doing this, there are children who are already on like BiPAP at night or oxygen at night, who are, potentially much more compromised, where a little, 10% down can be a big difference. Hopefully she has some buffer. And obviously Dr. Lumen and our anesthesiologists as well as ICU are very used to dealing with, we do a lot of these surgeries in patients, with, kind of a similar underlying history as her. So they're sort of prepared to do whatever needs to be done. But the likelihood with the spinal fusion surgery or with any kind of spinal or thoracic surgery itself is probably a little bit higher, just because
of what they've done.
Exactly.
Not because she's handling it worse, but just because what it is.
Exactly. It's just it has a much bigger impact on her ability to, to kind of generate breath right away. There also may be more discomfort and pain involved in that. So, it's again, it's hard to say. She may be extubated to oxygen. She may be extubated to positive pressure of some kind, like CPAP or BiPAP. Yeah. Oftentimes, particularly in kids who are, again, potentially on a little bit more support at night or something like that, they'll maybe they might like keep them intubated for a day, let them kind of stabilize out, and then extubate them through that support. The next morning.
Will they, if they keep her intubated, will they keep her sedated?
Yes.
So she doesn't know.
Yes.
Okay.
I mean, obviously the level of sedation, depends on the ICU, and they often kind of want they find a good balance, right? But so she wouldn't want to be like.
Can they tell when you're not verbally responsive if you're sedated just by looking at you? Because she plays possum really well when she feels bad or doesn't want people bugging her.
So I mean, I would certainly talk to the anesthesiologist in the ICU about that, but they're very I think most people who use medications like this are very cognizant of like we don't just use paralytic people. Like we don't paralyze people without also sedating people. So
you stop them about that stuff.
yeah, but there's absolutely an understanding of the anybody, right? Like I could paralyze anybody, but it doesn't keep you from.
I didn't even understand that.
Yeah,
process.
there's lots of different medications that have different impacts. Usually, the ICU folks start with more things that have to do with kind of
sedating
and consciousness, not the sort of paralyzing, but occasionally they need to do kind of the paralyzing. But most of the drugs that they're using are pain management and kind of sedation. So it would be kind of lumped in there. But they have a lot of different things that they can use. And obviously they will be looking to you guys to say, this is what she does when.
Yeah, it's hard for us to tell sometimes. You trick us, don't you?
What other questions?
That's it. Do you think that anything we need to be asking, or?
I mean, I think that's really it. I always want to make sure that parents are just aware that, for the spinal fusion surgery for anybody is a big deal, but particularly for our children who also have underlying developmental and neurologic issues that can just sort of compound. But again, I think you're in good hands. This is the right place to have it done in terms of being in a large children's hospital with pediatric everybody who have experience in doing exactly this in children as complicated as partner. So it's and it sounds like it's the right time to have it done if her scoliosis is rapidly progressing, because at some point it will start to compromise.
It started hurting her just a few months ago, but it's lower. I think it's more affecting her digestion than her lungs because a lot of the curve is down there. Yeah, and again, it's it's hard to know given that you just had that sort of one-off of that illness, but it's certainly possible that as she's grown and as her scoliosis has worsened, that you're sort of seeing a tipping point, like the fact that last illness took longer to resolve. She's gotten bigger, so her oxygen demands are a little bit worse, and if her scoliosis has worsened so that her lungs weren't able to keep up with that demand, she may have less reserve. So as you get bigger, you have to have stronger lungs in general.
You get more lung tissue. And so that we often see a sort of evolution of the time with this scoliosis, where you and that's part of the reason why we think that you can't necessarily regain what you lost with the scoliosis, but we can also prevent it. Right. Well, let me take a listen. Obviously, I'm happy to answer other questions, but it sounds like, again, she's overall doing quite well. Certainly, the ICU is going to be prepared to support her with whatever she needs, and our team will be around to get involved if needed. If she's going home looking like a rose, they probably won't involve us at all. If they have concerns that, at least in the kind of short-term home, she may need some more support as she continues to recover, like she might need to go home on oxygen regularly or something, they may involve us just to make sure that we're all on the same page, because you would be following up with us to decide when to take that off. But hopefully she'll just be in recovery. Okay, perfect. All right. Let's take a listen, okay?
Not someone talking for her, are you? No. She seems nice.
Sounds good. Yeah. Great.
You like her, don't you? Look at those white eyes. You like her? Because I know you're not going to make me do schoolwork.
Yeah. Plus the goggles are interesting, right? Like, not every doctor comes in. I know. Our COVID stuff is like, I get a lot of people like, oh, they're cool.
We have one PT person that comes in our home that the N95 masks don't fit her, and they have to wear N95, and she has like a bubble head suit.
Oh, wow.
And Raelynn does like working at her bubble head.
That is thankfully.
Can you show her your white tongue? Let's say Hey. Can you write her tongue?
I mean, it doesn't look horrible to me.
Can you say
I don't see any other reasons. I think if it didn't change at all, and I defer to your, to your prediction that
we cut back the sugar a little bit in her diet, and I feel like it got a tiny bit better, but then I'm like, no, it's definitely still all that white stuff, but you shouldn't just ask for primary care to look at it.
Yeah, and I agree with you. Oh, I'm sorry. You didn't like that. One other ear. I think I can all right, your ears look good. That's all I got. Wasn't too bad. Can you help me put this back on? Yeah. Here, we'll do that. There you go. I agree with you that, particularly in children who aren't eating with their mouths and aren't using their mouths as much, that sometimes we do see that build up on their phones. And I don't, if it didn't change with 2 rounds, 2 courses,
Maybe we don't even have to worry about it.
I would defer to them if they wanted to do any other testing or try any other treatments, particularly given that it's just on the tongue and not, on her cheeks or anywhere, or cheeks or anywhere else. It's hard to know unless we give a scrape or a fungal culture or something. So I would sort of defer to the All right. So again, I don't think we need to change anything right now. It sounds like she's doing well from a secretion standpoint, and just hope for the best of surgery.
Follow up in a year with you as long as
totally
it stays.
Yep. And you can do it with me or Dr. Rivera, whichever works for your schedule. And then definitely if you have concerns, if for instance. Again, hopefully this doesn't happen, but you're noticing a pattern where she's on
I'm pretty
more
sure
or
we talked to you when we had that strep oxygen issue over the phone.
Oh, okay.
And you helped give us some tips, and I forget what you said, but it was helpful.
Okay, good. Well, I'm so fun. So certainly if there are issues that come up, I'm happy to see her sooner or to talk on the phone. But if she is able to kind of get through surgery and go back to her baseline, then absolutely I think through a year. Okay. Good. All right, has she had a flu?
No, they were going to bring one in.
Yes, I will get that going. And then I don't think we need to give any documentation in particular unless we...
Paperwork there for it.
We don't need any papers about it. I gave it for flu. It's fine.
Yeah. Perfect. Okay. All right, I will get, I doubt that my clinic schedule is built out a year from now yet, so you may just
We'll give ourselves a
6 months
reminder.
or something. And then otherwise, let me know. And then again, if there are questions that come up, particularly obviously those, but we're around, so you can always ask to talk to pulmonary when she's in the hospital.
Thank you.
Okay, all right.
Thank you so much.
No problem. Nice
Good to meet
guys.
you.